Hi, everyone. This is Sean with the MassSupport Network here with your COVID-19 update for Friday, February 19th, 2021. So it was 2 weeks since we last checked in with Public Health Report. So we'll look at the data over that span of time. A significant drop off in the active cases around the state. It was over 61,000 as of 2 weeks ago, and now it's just 38,000. Still a lot, but a significant reduction there. 2 weeks ago, we had about 20,000 people undergoing quarantine or monitoring for suspected cases, waiting test results. Now it's just 13,000, another significant reduction there. The active isolations 2 weeks ago was 64,000 people were in isolation for confirmed COVID cases. This week is down to 39,000 cases, and a significant drop off there as well. The average age of hospitalizations remained at 70, while the average age of deaths from COVID-19 dropped 1 year to 79 years of age. Hospital usage has come down significantly, almost a reduction of about a third in terms of hospital beds taken up with COVID-19 patients. Also, ICU and intubations have dropped as well, not as much, of course. Those are going to move a little bit more slowly, but still significant reductions there as our hospital system is more able to deal with the reduced cases here. Testing is also increased as there are just fewer cases, fewer exposures. So we're getting now just about 1 3/4 days on average. So less than 48 hours there. Turnaround is pretty nice. Looking at how our contact tracing is doing, it is steadily moving up there. We're seeing over 85% of cases of outreach completed, which is pretty solid there. Also, the amount completed within a single day has gone up as well, from 78% 2 weeks ago to 82% in a single day this past week. Of course, contact tracing data is, as you can see in the numbers there, a little bit further behind than some of the other data we use here. So we're probably even a little further than this. In terms of counties, things are falling around the state. Last week, or excuse me, 2 weeks ago, the average daily incidence rate, the number of new cases per 100,000 people per day, was 59. This week it is 30, and most counties fell by about a half, with, of course, one obvious exception, which is Hampshire County, which increased by about 50%, largely driven, of course, by the outbreak that's going on right now at UMass Amherst. But just about everywhere else has dropped off significantly. The point where it's actually notable that UMass outbreak makes Hampshire County actually the highest transmission county in the state, which doesn't sound like it should be a good thing, but when Boston has lower transmission than somewhere else, that's actually kind of good. But again, especially when that it should hopefully be a rather ephemeral outbreak and will hopefully be under control shortly. That just shows the rest of the state is really on its way down too. Looking at the percentage of test positivity, you'd see that's continuing to trend downward. Just 2.1% of COVID-19 tests are coming back positive, which jumps to 3.6 when we factor out the screening tests done in higher education institutions. It's probably not bringing it down as much as it normally is due to the UMass issues. But these are still very encouraging numbers. We're well below 5%, which was always our threshold back in the fall of when things were getting serious. So that is really good. And we just need a few more weeks of riding out, letting these cases diminish, and we'll be in a pretty good place there. So looking at the 7-day average here, just hope this chart to show where we are equivalent to in the fall. So we've just hit around where we were in early November. November 10th is about the last point. Our 7-day average of new cases was at this level, which is just below 2,000, which is pretty, if you jump back and talk to us, anyone back in the summer or fall, this would seem like a wildly high amount of cases, but for the winter's perspective, this is looking pretty good. One other thing I wanted to pull up here, we mentioned the estimated active cases. This is a statistic that they started projecting in early November, and just show how that's changed since they started estimating the number of cases in the state. And you can see when it first started, we were a little below 20,000. Now we're a little below 40, and how that has changed over the last 3 months. See how it did steadily rise for a while, spike a little bit after Thanksgiving, plateau a little bit over the holidays when we're probably getting less testing, and spike a little bit after New Year's, and then just steadily decline throughout January. So that shows things are going, and hopefully we can keep that trend going downwards. One last thought to go out to the weekend. Anytime I need a little boost of happiness and hope, one of my favorite things, of course, is to see when a NASA control room bursts into cheers, as it did when the Perseverance rover landed on Mars yesterday afternoon. There's just something so I find so pure in the hope and joy of that particular sensation of seeing all those NASA controllers erupt in joy at the moment of a interplanetary touchdown. And I hope that makes you feel happy as well. So for more from the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be there if you need us. Stay safe.